Hello, guys. Thank you for joining me. So, today, the topic I want to talk about was the nursing pathway for paramedics. What are some of the different ways you guys can get into nursing? I'm going to try to keep it as quick as I can. I wrote some notes to kind of keep me on track. So, first thing I wanted to say is that nursing is very competitive. It's a lot of competition to get into nursing. I didn't really realize how competitive it was until I started doing my research. But just to give you an example, the bridge program I got into only had 10 slots. So there was a lot of competition to get one of those 10 slots. That's how competitive schools are across the country, especially with the shortage of nursing educators. It's become even more competitive. So, what are some of your other options? And I've done some research before I decided to apply just to look at what option will work best for me. Some of you guys are working full time and want to know, hey, which would be the better option for me because you have to maintain your household. I agree. Some of you guys are probably working two jobs thinking, hey, how can I get involved with nursing? Because here's the truth. The truth is, they both options require a lot of time. It's nursing is rigorous. It's not just the content that's rigorous, but it's the amount of content. It's the tests that's rigorous. It's trying to manage lab time, clinical time, class time, study time, and work a full time job. Um, in my bridge, I know we had half of the paramedics working full time. Some of the folks like myself had to downgrade from working full time to just working a casual time as much as I could because I didn't see myself passing nursing school trying to work a full-time job. It was just that rigorous. But some of my classmates did. Hats out to those guys. So I want to talk about the advantages and disadvantages of um, different ways of going to, because there's really two main ways. You can go to community college or university. But there's one common theme. That one common theme is your grades. I'm wearing a Honor Society shirt today, which I'm proud of, because to earn my degree before nursing, I was an A student. And today, I'm still an A student because I realized that with B's and C's, it would be hard for me to compete. So I knew from the outset from the onset, that I had to be an A student. So if you guys kind of maintain that, even if you have to take one class a semester, just take one class a semester. But your grades are going to be the most important thing to help you get into either one of these programs. So the first one I want to talk about is a community college. What are the advantages of going to a community college? Usually it's more to choose from. In an hour distance from me, there's about 67 community colleges. Universities, there's about 5. So there's more colleges I can apply for nursing programs in my area than universities. Also, community colleges is what traditionally has the paramedic to RN, and it's usually 3 semesters. So usually 1 year to 16 months, and you're done. My program was 16 months. Also, it's cheaper tuition. Another advantage is that usually ADN programs are usually more practice focused. There is some leadership content. We are graded on leadership. We do have a leadership class, but the main focus is more practice focused and help you pass the NCLEX. There was smaller class sizes. When we first started, it was just 10 of us. Then we merged in with the LPN students before we merged in with the traditional students. So I felt like with a smaller class size that I can ask more questions, and there were less distractions. But the disadvantages is you earn your ADN, which is associate degree in nursing. Why is that relevant? Because the 2 hospital systems that I work for, you had to have a BSN within a short amount of time, maybe 5 to 7 years, in order to remain hired there. So I looked at that kind of as a disadvantage. Now, on the university side, of course, the advantage is you come out with the BSN. Your BSN is important because if you want to hold usually a leadership position, they usually toward to look more to BSN prepared student. I mean BSN nurses, then they usually do ADN. Not trying to say you can't be a charge nurse, but if you want to hold a unit supervisor or if you want to be a unit educator, typically they want you to have a BSN. Also, the BSNs are more typically practice and leadership focused. You can also transfer in with a university with an associate. So if you have an associate's of EMS, you can literally transfer. Have one of my work colleagues that did that. She was a paramedic who literally transferred her associates in EMS to a university, and she earned her BSN in 2 years. So that's a good option if you wanted to go university route. What are some of the disadvantages? It's usually higher tuition. And also, if you don't get accepted, then what are some of your other options? Some of your other options may be to extend for another year to try to get into the program, maybe change your major or drop out. My sister-in-law, she went to a university. She didn't get into that university's nursing program. She went back home to a community college. She got her ADN. She wound up transferring right back in and attended the same university's RN to BSN program, got her BSN while she worked at a level 1 trauma center. Did that affect her success? No. She's a brand new Air Force major. So congrats out to her. So it doesn't matter if you go the ADN route or the BSN route. You can still have the same amount of success. The key is to get into nursing. Now, there are some other university entry pathways that I'm going to talk about just briefly. Is accelerated BSN. For some of you guys who already have a BSN, who already have a bachelor's, then you could literally go to a university and get an accelerated BSN. You can get a BSN within 1 year. It's called bachelor's to BSN or accelerated BSN. Another entry pathway is for those of you who already have master's degrees. There are direct entry pathways if you have a master's degree to get your master's of science in nursing. So those are just some of the options that you got where you don't have to settle in trying to get to a paramedic to RN. There are other options available. If you guys have any questions, just leave your comments. Make sure that you subscribe to my channel, and also you can visit my blog that blogs my whole nursing school journey for you guys. Thank you for joining me, and happy nursing.